wrong time, wrong patient, wrong dose, duplicating a dose, omitting a dose, not following established protocols like using the 7 rights, and utilizing workarounds, documenting retroactively instead of right then and there. Medication errors are the most common types of errors in hospitals or clinics. Carefully follow Killeen ISD's medication administration guidelines. There are simple things you can do to help prevent medication errors. Always follow the 7 rights of medication administration. Create safe and organized medication cabinets in your clinic. Keep your MARs and documenting organized and tidy. You should be documenting all on paper or all electronically, not a combination of the both. And all clinic staff for each campus should be congruent in the type of documentation being completed. Avoiding medication errors. Preventing medication errors is the responsibility of the entire team. Be aware of the federal, state, and local laws and facility protocols or guidelines pertaining to medication administration. Perform accurate dosage calculations. Maintain knowledge of acceptable skills and competencies. Accurate and timely documentation, determining the accuracy of medication orders, report all medication errors. These are some good practices for when you are administering medication. Ask the student their name. Find the correct medication in the medicine cabinet and turn to the student's medication log in the MAR, or have a printed MAR from the computer that you could easily access and then allow for electronic documentation later. Check to make sure the medication and dosage in the bottle matches the medication written on the medication log. Make sure it is the right scheduled time, or for PRN meds, assure there has been enough time between doses. Make sure you are giving it in the right route. Make sure, once again, that the medication is the correct medication for that student. Give the medication as ordered. Immediately document. Good habits matter. Meds should be given within 30 minutes of the scheduled time per doctor's orders unless otherwise specified by the doctor. Do not leave the medication cabinet unlocked. Keep the keys on you. Do not take the student's word about a medicine. Always verify by calling the parent. We cannot give an extra dose of a med if a student forgot to take it at home. The parent can come and give it. If there are any questions, contact your nurse or health services. Nurses, if you have any questions, contact the doctor and the parent or health services. What to do if a medication error happens. Monitor the student in the health office for any adverse reactions. If the student has already returned to class, please have them return to the health office. Call the parent to pick up for closer monitoring and/or EMS transport patient to the emergency room, depending on the medication that was wrongly administered, wrongly dosed, wrong route, whatever the instance may be. Take vital signs and monitor mentation and level of consciousness. Document what you see. Call poison control. Report the medication error to health services, the school principal, parent or guardian. Determine if there's a need to contact the physician. Complete a Clean ISD medication error report form. Complete a Clean ISD incident report form. These are sample questions from the medication error report form, Clean ISD incident report form, considerations of the Texas law, and a Texas Administrative Code. This code is a standard of care that all licensed and registered nurses must comply with in practicing in Texas. Standard 217.11 requires nurses to know the rationale and the effects of the medication and treatments that they are administering to students. In addition, the standard code requires nurses to only accept assignments that they consider commensurate with their educational preparation, experience, knowledge, physical and emotional ability, and within their scope of practice. That means speak up to me or health services office if you feel that your assignment is not appropriate or you do not have adequate education or support. If a nurse is unsure of the dosage or effectiveness of the medication to be administered, they are required to seek clarification from the student's prescribing practitioner. If a nurse decides not to administer a medication, then they should notify the ordering practitioner with their decision. Resources. Let's be better together. You may also utilize this presentation when medication errors occur to re-educate yourself or staff. If it is a nurse, it will be assigned to you via Strive. If it is a clinic aide, your nurse can either assign it to you through Strive or can present the presentation to you themselves.